So his left shoulder was continuing to hurt, and he was in the office. So there was no reason that I could think of. So it could have just been coincidence. So I examined his shoulder and mobilized the shoulder joint, and when we were done, after a 5-minute procedure, he was able to lift his arm with a lot less pain. So I just told him to come in again in another week for another mobilization, and we'll just watch that. I think that I don't know what that was. It could have been just something that he did. He had traveled for work, so he might have strained something that way. So. His back pain is now 50% better.
That's great.
He's had no hip pain at all, but he said it had a history of coming and going, so we'll see about that. And the knee pain is much better. He said it's pretty good. So, again, I told him just continue using the remedy as needed. Wait until you start to feel that energy is going down or pain's coming back up, and take it again and go with it. So it looks very, very good.
Good.
I am hopeful that this is the simillimum. We don't know for sure yet. We'll know in another, as the months go by, if he continues to improve. Another sign that it's the right remedy is, as we talked about before, if we continue to go up in potency and he reacts better and better and longer to the higher potencies, then we know that's a really good sign that this is a very similar remedy. If each time we go up in potency he reacts worse and worse, there's some reaction but it's not as good or not as long lasting, then we're probably dealing with a remedy that's similar, but there's a remedy out there that's even more similar. But for now, we're going to continue with the nitric acid and keep using that, and I'll keep you posted on how he does. But I'm expecting that we should expect now at this point every month he should make a little more improvement. He should get better, whether 10 or 20% improvement each month now as we go. So in a year he should be a different person.
Wow. Dr. Ezgur, where does aggravation fit in that piece of saying it is the correct remedy?
The classic response to the simillimum, to a well-chosen remedy, would be an initial brief aggravation followed by a long continued improvement.
Okay.
So that's a great sign. So when you have a small aggravation for a few hours or a day or two, followed by several days or several weeks of improvement, that's your best case scenario. You don't have to observe an aggravation in order to get a good result, and oftentimes even with the simillimum, you sometimes won't see an aggravation because maybe it happened during their sleep or they weren't aware of it, or for whatever reason it just didn't happen. So you don't have to have the aggravation in order to know that you're on the right track, but when it does, it's just one more confirming piece of the puzzle that you've done the right thing. And there will be less, the more chronic or long-lasting the condition is, the more chance of an aggravation. The more acute the problem is, the less chance you'll have. So if it's a very acute, severe, high fever kind of situation,
They're already aggravated.
Very often, they're already so aggravated, you very rarely see an aggravation. In the case of a headache, like an acute headache just coming on, you could probably take the remedy every 5 minutes or 10 minutes or 20 minutes and you won't see an aggravation. It's virtually impossible to have an aggravation during an acute headache because what we call the ascendancy of the disease is it's so rapidly progressing. A headache starts out here and it goes to here within minutes. So you take it and it just keeps, you kind of are batting it down, but the disease is doing this, so you're not going to get as much of an aggravation as you would from just the kind of chronic, low-grade disease that's just been doing this for a long time. You introduce a change, it's a big change, the remedy, and then your body reacts.
That makes sense. So anytime you prescribe something for TJ, it's always acute conditions. So he's never had an aggravation.
Never had an aggravation, right.
Just either worked right away or took a little longer.
And it depends on the sensitivity of the individual. Someone who has allergies and asthma, the atopic patient, allergies, asthma, eczema, psoriasis, these kinds of things, you give them a remedy and they're sensitive, you might see a big aggravation, so that's where you want to be careful. That's why when you're treating as you are, you want to use much lower potencies and be much more careful because, you don't, it's a more problematic situation when you have aggravation and you're not sure what to do and you're not maybe as good in a place to judge how sensitive a patient is or not. But that's definitely something to consider. You have the book, it kind of gives you guidelines as to how often to repeat the remedy and what potency, but always know that if it's a really sensitive patient, just adjust it downward. And if you're not getting any response, no aggravation, no improvement, try repeating it more often or change remedies.
So what level did you
So
give
we
them?
used a 200C,
200C?
which is a pretty typical place to start for kind of a chronic person of average sensitivity.
Okay.
If someone's really sensitive, we might start in a chronic case with a 30. And if the condition is chronic but more like acutely problematic right now, like there's some recent development where it's at a heightened level of severity, might go with a 1M or even a 10M.
Okay.
Yeah. Anything else?
So when will we find out what the remedy is, Dr. Ezgur?
So again, as we give this time and we go up in potency and he continues to get better, then we'll know that
that's
for
what
sure.
it is.
Certainly this is a very similar remedy. It's having a great impact. I mean, he's basically 30 to 50% better within a month. So
we can kind of use this information to kind of go, if say we thought that it was a particular remedy and you've kind of like knocked it out the box now, we can go back and review and see what else we might consider.
Right. I would say that Natrum muriaticum is not out of the question.
Okay.
Staph aureus may not be out of the question.
Okay.
Arsenicum could potentially be could play into it. And typically, if for a chronic case, you don't see cure unless you use oftentimes it takes 2 or 3 or 4 remedies, so there's a progression. So at some point, if he improves a lot, he may need this remedy for a few months or even a few years, or even the rest of his life. But at some point, the picture could change. He could start getting less anxious, but he could start developing some skin symptoms, and he could start getting warmer and craving sweets, and then the symptom picture would shift over to like sulfur, for example, and then we'd need sulfur for a while. And oftentimes sulfur is actually a remedy that kind of can finish off the last bit of a case and to total cure. So there's oftentimes a progression from one remedy, and there's a pattern of certain remedies will follow other remedies. So you'll start with one thing and it'll go to another. And that's the same thing even like an acute fever or flu. You'll see that like the remedy that you start with might be like aconitum, and then it turns into phosphorus and then sulfur or something. Or you might see in the case of injury, the arnica you give in the first couple days when it's really inflamed and acute and painful to touch and sensitive, but then it starts getting more, not so acutely painful, but more stiff and achy, and it's like worse in the morning and worse in the rain and the weather, and then when they move, it feels better, and so then maybe a remedy like rust toxicodendron is indicated. So it's not uncommon that you'll see a progression from one remedy to the next, even in an acute case, to get it to see you through. Or in a common cold, it goes through stages, right? First it's up here, and then it settles down here. So you might go through different stages and need different remedies to get to get all the way to cure.
And so once you get all the way to cure, if there's a flare-up, would you consider the remedy that you used at the end to be their constitutional?
Probably. I mean, likely.
Okay.
But you need to ask questions, is everything the same and it just kind of came back? Then take another dose of the same remedy. But is it something came back, but now it's also, there's something different?
Okay.
So then the new symptoms that develop are the most important ones to guide you to the next remedy. Okay. So if something totally new comes up, if one little symptom comes up and it's not that big a deal, I kind of stick with it. But if it's a major shift and things stagnate and keep from getting better now, like he's 80% better and holding for a long time, and now some new symptom comes up, then you look for that. The new symptom is going to guide you to the new remedy, but that new remedy should also cover the symptoms that still haven't been cured.
Okay.
So whatever's still left, maybe half are cured and half are still there. Look at the ones that are still there and the new one, and you'll find your new remedy, and that should get you to the next level.
Okay. What are the factors that you decide a person needs certain remedy for the rest of his life?
You never know that,
Okay.
like, in advance. But if this person's symptoms are the same symptoms he's had since high school or college,
Okay.
or even before that, then there's a good chance that that's the remedy the person may even needed when they were born. And so there's a strong likelihood that they'll need it for a long, long time. Maybe their whole life, or maybe up to a certain point. You don't know, but as long as they keep improving with the remedy, you stick with it. And if every time, if they relapse every 6 months or every 6 years, and the same remedy gets them back on track, then that's the remedy they keep going back to. You said, ask your question again, because there was something else I was going to say on that. How do you know it's the same remedy?
You said some people are on the same remedy for the rest of their life.
Right.
What is the key thing that determines that he or she needs to be taking that?
Yeah. So it's
Yeah.
basically if the symptoms, characteristic symptoms, fit that remedy. The other thing is that there'll be changes, especially like in women, different phases of life. So at menarche, at menopause, when pregnant, after pregnancy, all those changes of life and phases of life oftentimes come with a different remedy. Sometimes the same remedy stays and still fits.
All right.
Yeah. Okay, good work. I'll keep you posted. So again, if you want to continue to follow what we're doing, just go to the website, progressivechiropractic.com, go to the homeopathy section. You'll be directed to the Facebook page. You can certainly ask me questions that way. There'll be kind of a discussion forum there. And hope that you continue to stick with homeopathy and continue to learn about it and study it and use it for yourselves and your family. And good luck with it. Thank you.